Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses in nursing competitive exam as well as IELTS and NCLEX and OET training. Welcome back to Magic Pill session. As you all know that in Magic Pill session, we are discussing very important topic, previous year question papers and golden points related to each and every MCQs, rational related to each and every options, each and everything, whatever is essential for your upcoming examination, we are covering that. So watch the video till the end. Definitely it will be so much useful for you. And today topic is very important. That is different types of color syndromes. Color syndromes we are going to discuss. It is related to pharmacology. So watch the video till the end. And only few days is there for your upcoming NORCET examination. So from the Metier side, we are continuously giving magical session. Please watch those videos in which is streaming in e-nursing Metier YouTube channel. So many magic pill videos are there. All important MCQ points are covered in those magic pill videos. So watch those videos so that you will get an hands-on experience. So let's start the session with your thought of the day. Success is the sum of small effort repeated daily. How much effort you are giving towards yourself every day. So that matters. Please give yourself 100%. See, hard work and smart work both matters. But every day you have to give more and more input on yourself. Then only you can easily achieve your success. With this thought, let's start the session. As I mentioned already, the topic today what we are going to discuss is related to pharmacology. So many times asked in the exams, that is drug-induced color syndromes. Okay, so this is the very important topic. So many times they have asked in competitive exam. That's why we have selected this topic. So let's start the session with the first question. The first question is, a 52-year-old patient is admitted with MRSA septicemia. During intravenous antibiotic administration, he suddenly developed flushing. First key point, during intravenous administration of some antibiotic, immediately the patient developed flushing of face, neck, upper chest, and also the patient developed itching and erythema. So these many reactions is taking place after administering the antibiotic. So the nurse immediately slows the infusion rate. Okay, it means that previously the infusion rate was fast. So now the nurse immediately slowed down the infusion rate. Which drug is most likely responsible for this adverse reaction? Always I used to say that key point is very important and the last line is very important in each and every question. Here the key point is flushing of the face, neck, upper chest, itching, erythema after administering the antibiotic, IV antibiotic. So the second one, the last line, very important, which drug is causing these reactions? Hypersensitivity reactions. Four options they have given here: amidrone, vancomycin, rifampicin, and chloramphenicol. So among these, the right answer is going to be what? Option B, that is vancomycin. Guys, vancomycin is the one which is administered very fastly, very quickly, means this kind of hypersensitivity reaction is very common. Okay, so whenever the person is getting the vancomycin in the very fast infusion rate, that time hypersensitivity reaction, it is triggered by the histamine. So histamine is the one which is causing flushing of the face, neck, upper extremities, itching, erythema, all these things collectively given by the histamine because of what? Fast or quick administration of vancomycin. Understand? So here the right answer is going to be what? Option B, that is vancomycin. Here I have mentioned very clearly in the rationale, when the vancomycin is given, it is an antibiotic, everyone knows about that. When it is given too quickly, immediately the patient will be developing these kind of symptoms, and these kind of symptoms are collectively called as what? Red man syndrome, because erythema is very common and it will present all over the body. The erythema, it is commonly seen all over the body. That's why it is called as what? Red man syndrome. Understand, right? So what we supposed to do? See, we have to reduce the flow rate, infusion rate. We are giving fastly, that's why this kind of red man syndrome is happening. So we have to reduce the rate. Understand, right? So how to remember this red man syndrome? So you can see the image very clearly. Anywhere all over the body or any particular part, red color erythema will be present, and it is commonly seen because of vancomycin quick infusion. Understand? So how to remember this? Red man syndrome is caused because of what? Vancomycin, rapid IV infusion. And what we supposed to do as a nursing officer, we have to reduce the flow rate. Understand? So image based question also you can expect. So this is the red man syndrome, guys. Okay, right? So the second question is, a 67-year-old man with a recurrent ventricular arrhythmias has been taking antiarrhythmic medication for the past 2 years. So first point is over. Past 2 years, the person is taking antiarrhythmic drug. During the routine follow-up, the nurse noticed blue-gray pigmentation. The previous question is related to red man syndrome, and this question is related to blue-gray pigmentation. Okay, that is blue man syndrome. Let's see in detail. Okay, so blue-gray pigmentation over his face, and especially, very important point, especially in the sun-exposed areas. So which medication is mostly responsible for this adverse effect? Very simple. The person is taking antiarrhythmic drug for a long period of time. Here they have mentioned for the past 2 years he is taking the antiarrhythmic drug, and he came for the routine checkup. There a nursing officer, he saw the patient and he assessed that the patient is having blue color discoloration, that is blue gray pigmentation in the face, hands, wherever the sun is exposed. See, wherever, with whatever the body was exposed to the sun, in that area this kind of blue gray pigmentation is present. So sun exposed area, blue gray pigmentation is present. That is the key point. Okay, so the second one is, which drug is causing this kind of blue-gray pigmentation or blue man syndrome in the sun-exposed area? 4 options they have given here: phenytoin, warfarin, amidrone, and minocycline. And here the right answer is going to be C. It is a antiarrhythmic drug. So here the right answer is going to be what? Option C, that is amidrone. So here I have explained very clearly about the rationale. See, amidrone, as I mentioned already, it is an antiarrhythmic drug used to treat the abnormal arrhythmias. Okay, but if the patient is taking this kind of antiarrhythmic drug, especially amidrone, for a long period of time, that time the patient will be getting what? Blue-gray discoloration of the skin. That is called as what? Blue man syndrome. That is called as what? Blue man syndrome. Why? How it is happening? Always you should ask why. Then only you will get the rationale. See, this drug amidrone, it is going to sediment or accumulate all over the skin. So keep on accumulation of the skin means this amidrone keep on accumulating all over the tissues or the skin. So that time it is becoming more sensitive to the sun. So whenever this person is exposed to the sunlight, immediately some kind of hypersensitivity reaction is taking place. Photosensitivity reaction is taking place. That time the skin is changed into blue color. Okay, the normal skin tone is changed to what? Blue color. That is called as what? Blue man syndrome. Accumulation of amidrone in the skin, because the person is taking the amidrone for a long period of time. Whenever he exposed to the sunlight, that time the skin automatically turned the color to blue. Okay, so that is called as what? Blue man syndrome. Okay, so it is caused because of which drug? Amidrone. Okay, so the third question is, okay, you can see here I have added the image also, blue man syndrome. So what we supposed to do? If the person started with the blue man syndrome, what we supposed to do? We have to reduce the dosage. If we reduce the amidrone dosage, automatically the blue man syndrome will be reduced. The blue color discoloration like this, the blue color discoloration will be automatically reduced. Understand? Right? So this is the only thing what we supposed to do. And the next one is question number 3. A 65-year-old man started on oral anticoagulant 1 month ago for a deep vein thrombosis. Okay, the first key point is anticoagulant patient has taken. Now he complains of painful purple discoloration of his toes. His toe is changed the color. The color of the toe is becoming purple and it is painful. Purple, painful discoloration of the toe is the key point after taking the anticoagulant. After taking the anticoagulant. So that is also a key point. Okay, right? So although peripheral pulses are normal, which drug is most likely responsible for this painful purple discoloration of the toes? 4 options they have given here: vancomycin, warfarin, rifampicin, and chloramphenicol. Here one key point they have already given: anticoagulant. So anticoagulant means definitely we know that warfarin is the anticoagulant, and warfarin is the one which is causing painful purple discoloration of the toes. You can see here the right answer is what? Option B, that is warfarin. Okay, so warfarin, what it is doing, why it is causing the painful purple discoloration of the toe, otherwise called as purple toe syndrome. Otherwise it is called as what? Purple toe syndrome, commonly seen because of the warfarin. See, warfarin, why we are giving? We are giving the warfarin to dissolve the thrombus. Once the thrombus is dissolved, it is breaking down into small emboli. So that small emboli is traveling in the blood vessels and it is blocking the capillaries. Once the capillaries are blocked, for example, consider this is the toe. The capillary which is supplying to the toe is blocked, means this area will become cyanosed. Once this area is becoming cyanosed, that time blue color discoloration will take place. Otherwise, purple color discoloration will take place. Understand? Let me show the image also. So this is how it looks. So purple color discoloration is taking place in the toe because of decreased blood flow to the distal part of the organ. Okay, because of the microemboli formation, which is caused because of what? Warfarin. Understand? So these are all the key points. This is how you have to make your thought process. Okay, right? So on the whole, the simple, easy to remember is purple toe syndrome. It is caused because of what? Warfarin. Okay, so the next one, fourth question, a patient is receiving treatment for pulmonary tuberculosis, becomes worried about noticing orange color urine and tears. Which drug is responsible of this finding? This question asked so many times in the exam, and very simple question, direct question, everyone knows the answer. Yes, correct. Here the key point is orange color urine and orange color tears. After taking a drug or treatment for pulmonary tuberculosis, the patient is undergoing a treatment for pulmonary tuberculosis. There they are prescribing some drug, and that drug is causing orange color urine and tears. And what drug is that? This is the question. And four options they have given here. As you all know that the right answer is going to be option C, that is rifampicin. Rifampicin is the correct answer, and this is the one which is changing the color of the urine, tears, sweat, saliva, all the color is going to get changed. Okay, so here the right answer is what? Option C, that is rifampicin. See, rifampicin is the first line drug for anti-tuber in the anti-tuber medicine. Okay, if the patient is suffering from tuberculosis, the first line drug is rifampicin. So this rifampicin, it is mixed with the blood and it is expressing out through the urine, saliva, tears and sweat. And this is harmless, so this information has to be informed to the patient priorly to reduce the anxiety of the patient. Understand, right? See, apart from that, what are all the golden points related to this? Let's discuss that also. See, drugs and urine discoloration. Very important one-liner questions you can get from this slide. Okay, right? First, let's solve related to rifampicin. See, rifampicin, already I said that the tear, sweat and the urine, even saliva, everything, the color is going to be transformed to orange color. So that is what you are seeing here. So apart from that, drugs and urine discoloration. If you are giving some drugs, the color of the urine is going to change. So what drug you are giving and what color it is going to change, that we are going to see. The first one, rifampicin. So already we discussed about this. So orange color, see, orange, red color urine or tears will be there. And what about nitrofurantoin? Brown color urine will be there. Brown color. Cimetidine, blue color urine will be there. Excess B vitamins, bright yellow urine. Amitriptyline, blue-green urine. Warfarin, heparin, red color urine. Metronidazole, orange color urine. Propofol, blue-green color urine. Chloroquine, dark yellow color urine. One-liners. You can get these type of questions in the exam. So you have to be very smart enough to answer these questions. Understand, right? So all these things are the additional golden points, guys. Okay, so let's move on to the next question. Question number 5. A newborn develop abdominal distension, vomiting, poor feeding, hypotension and gray color skin. Gray color skin. Now see, already red color skin over, blue color skin over, purplish toe over, orange color urine over. Now we are going to discuss about what? Gray color skin. Okay, see, the baby develop gray color skin after receiving an antibiotic. Which antibiotic is that? That's all. This is the question. 4 options they are given here: chloramphenicol, vancomycin, warfarin, phenytoin. Okay, among these 4, Which drug is going to cause gray color skin for the newborn? Okay, right? Direct question. So many times this question asked in the examination, repeatedly asked question. Here the right answer is option A, that is chloramphenicol. So chloramphenicol is the one which is causing gray color skin. Why? How? Why is very important. You have to ask why. Rationale behind the thing is very important. See, usually what is happening? The drug chloramphenicol, it is metabolized in the liver. First point, it is metabolized in the liver. Suppose the liver is affected. The metabolization is not taking place properly. So in this condition, the drug is going to accumulate in the body. First one. Second one, it affects the metabolism of the cells. See, once again I'm repeating, the first point is the drug is going to get accumulate inside the body, where especially inside the cell. Once this drug chloramphenicol is accumulating within the cell, it will damage the mitochondria process. Once the cell mitochondria is affected, the cell function is going to get affected. Suppose the chloramphenicol is going to accumulate in the myocardial cells, the function of the myocardial cell is going to get affected. So if the myocardium is affected, the cardiac output is going to get affected. So the person will not get adequate blood flow to each and every organs. So there is no adequate blood flow. So that's why the color of the person or baby is going to change to gray. Because of decreased blood flow to the cells or to the organs, the color of the body is transformed to gray color. That's why if the patient is taking chloramphenicol, the baby color is going to get changed to gray. Understand, right? So this is the pathology behind the gray baby syndrome. So what is the mnemonic? Not mnemonic. How to remember this? See, gray baby syndrome commonly seen in the chloramphenicol. Okay, guys, right? So the next question. So this is the gray baby. Okay, because of chloramphenicol. Okay, right? So the next one, question number 6. A 24-year-old woman has been taking a long-term treatment for acne vulgaris. First point, acne vulgaris long-term treatment. During follow-up, she developed diffuse black pigmentation of the skin. Black pigmentation of the skin. Okay, so she is taking a long-term treatment for acne, and when she come for the follow-up, her body is becoming black pigmentation. Okay, so which drug is responsible for creating this kind of black pigmentation? 4 options they have given here: rifampicin, minocycline, amidrone, and warfarin. And here the right answer is going to be option B, that is minocycline. Minocycline is the one which is coming under tetracycline, which is coming under what? Tetracycline. And this drug is causing what? Black color pigmentation. Okay, right? So as you all know that, see, minocycline is the right answer. See, minocycline, as I mentioned already, it is a tetracycline antibiotic commonly used for acne vulgaris. But if the person is taking it for a long term, that time black or blue black color pigmentation will be there. Not only in the skin, it is also present in the nails, gums, and it also makes scars. How it is happening? Yes, obviously, if you stop taking the drug, little changes will be there, but the discoloration will not be changed. Understand? You can see here what is the pathology behind this. You can see here very clearly. So this is how it looks. Okay. So black color all over the body will be there. Usually this minocycline, if the person is taking for a long time, so this minocycline will be mixed with the iron and melanin. Iron and melanin. This minocycline is mixing with the iron and melanin, and it is accumulating in the skin, nails, gums, and it also makes scars. Okay, so these scars will not disappear even after reducing the medications. Okay, right? So whoever taking minocycline, tetracycline antibiotic for acne vulgaris, please take here safe measures. Okay, so the next one, question number 7. While receiving an intravenous anti-epileptic drug, the patient developed pain, swelling, and purplish discoloration around the IV site. Another very important question. Purplish discoloration around the IV site extending to the ants. Which drug is responsible for this purplish discoloration? So here the patient is taking epileptic drug, anti-epileptic drug. While taking the drug, the patient is developing purplish discoloration over the hand. So which anti-epileptic drug the patient is taking? So this is the question. So four options, and among these four options, only one anti-epileptic drug is there. That is option B, that is phenytoin. Okay, so you can see here phenytoin. See, phenytoin, it is an anti-epileptic drug. While you are giving the phenytoin, suppose unfortunately counter puncture of the needle taking place. What taking place? Counter puncture of the needle. So once there is a counter puncture, immediately whatever the injection you are giving, it will extravasation inside the tissues. There is a difference between infiltration and extravasation. Infiltration means, for example, if you are infusing the normal saline, counter puncture taken place means that normal saline will infiltrate inside the tissues, but it will not cause any damage to the cells. But if you are infusing the drugs like calcium, potassium, phenytoin, these drugs will go inside the tissues and it will cause damage to the tissues or the cells. That is called as what? Extravasation. So phenytoin is also causing extravasation, and because of the phenytoin, the hand is going to become purplish color. Okay, so pain, swelling, edema, purple discoloration will be present. You can see like this. Okay, so the phenytoin is the one which is causing what? Purplish, painful discoloration. Okay, it is also called as what? Purple glove syndrome. What it is called as? Purple glove syndrome. Apart from that, warfarin already we discussed. Warfarin will cause what? Purple toe syndrome. Purple toe syndrome. Okay, right? So question number 8, a 7-year-old child was treated with an antibiotic as recurrent respiratory infection during early childhood. During a dental checkup, the nurse noticed permanent brown discoloration of the teeth. Very important key point. Permanent brown discoloration of the teeth. Which drug is most likely responsible for this brown color discoloration? Ciprofloxacin, tetracycline, azithromycin, amoxicillin. Four options they have given here. See, whenever you come across the word brown color discoloration, that is permanent brown color discoloration, you have to think about tetracycline, and here the right answer is what? Tetracycline. See, this tetracycline is binds with the calcium and it will accumulate on the bones and teeth. Especially if the mother is taking during the pregnancy, if the mother is taking tetracycline. Otherwise, less than 8 years of children, they are taking tetracycline because of respiratory infection. For these people, this kind of brown discoloration of the teeth is very, very common. Understand, right? So let me show the image. So this is how it looks. Brown color discoloration of the teeth will be present because of tetracycline. Okay, right? So question number 9, a 60-year-old patient undergoes surgery. Very important point. For septic shock and receives a medication in the intensive care unit. A few hours later, the nurse noticed that the patient urine has turned blue-green color. Undergoes surgery. In the surgery, they have given some medication. So because of that medication, the patient urine is changed to blue-green color. So what medication during the surgery they have given? Four option: methylene blue, furosemide, ceftriaxone, mannitol. So among these, the right answer is going to be option A, that is methylene blue. During the surgery, they would have injected a dye, surgical dye, that is called as what? Methylene blue. And this methylene blue is the one which is excreting in through the kidney in the urine, and that one will give a color called as what? Blue-green color. Okay, right? You can see here the right answer is what? Option A, methylene blue. See, methylene blue, two properties there for the methylene blue. Please remember this. This is the additional golden point. The first property, it gives the color. During the surgery, they will inject a methylene blue. It acts like a dye and it is used to see the organ very clearly. Okay, so it acts like a surgical dye. That is the one property. Another property, it is acting as an antidote for a disease. What disease? That is methemoglobinemia. Methemoglobinemia. Okay, right? So whatever it is, if you are administering methylene blue as a antidote, as a dye, whatever it is, that methylene blue, it will excrete through the urine and it will give the blue-green discoloration. Obviously, it is a temporary one and it is harmless. So it has to be informed to the patient priorly so the anxiety level will be decreased. Okay, another important point, already I have mentioned. See, this is the RBC. RBC contain iron, right? And the iron is the one which is carrying the oxygen. This is the normal mechanism, right? And what is the molecular formula for this ion? Fe2 plus. Fe2 plus. Okay, so this is the molecular formula, and this molecular formula ion has the capacity to carry the oxygen. Suppose in methemoglobinemia, in this condition, instead of Fe2 plus, Fe3 plus will be there. See, this ion is molecular formula is transformed from Fe2 plus to Fe3 plus. If Fe3 plus is present, that is called as what? Methemoglobinemia. So in this condition, the oxygen carrying capacity of the ion will be absent. So that condition is methemoglobinemia. In that condition, what we will be giving as an antidote? We will be giving methylene blue as an antidote. Okay, so whether you can give as a antidote or you can give as a surgical dye. So whatever it is, it will excrete through the kidney as in the urine, and it will give blue-green discoloration. So that is a normal one, temporary one. Okay, right? Fine. So the last question is, a nurse is revising drug-induced symptoms before competitive examination. Which of the following drug syndrome pair is correctly matched? Drug syndrome pairs correctly matched. 4 options they have given here: vancomycin, gray baby syndrome, chloramphenicol, purplish toe syndrome, warfarin, purple toe syndrome, phenytoin, blue man syndrome. Which one is correctly matched? Here, you all know that here the right answer is what? Option C, that is warfarin purple toe syndrome. Option C is the right one. Okay, what about other option? See, vancomycin, it will cause red band syndrome. Chloramphenicol, it will cause gray baby syndrome. Phenytoin, it will cause purple blue glove syndrome. Purple glove syndrome. Right? So, the only thing which is matched correctly is warfarin purple toe syndrome. Right? Okay. So, once again, a brief review. Vancomycin, you can see here. So, this is the drug and this is the color change or the syndrome. Okay. So, vancomycin will cause red band syndrome, amidrone will cause blue man syndrome, warfarin will cause purple toe syndrome, rifampicin will cause orange color urine, chloramphenicol will cause gray baby syndrome, minocycline will cause black syndrome, and phenytoin will cause purple glove syndrome. Right? Okay, guys. So, drug and color changes, syndrome, everything we have covered. Okay, right? Very, very important for your examination. So please watch these kind of magical session again and again. Already so many magical videos are streaming in e-nursing Metier YouTube channel. So watch those videos also and get the hands-on experience. And from the Metier side, we are providing crash courses for upcoming NORCET examination. So please join us. If you want to clear the exams in the first attempt, join us as early as possible. Online, offline, both are available. So if you want, you can join, and if you want to join, you can call us in the number which is mentioned below. Okay. So thank you very much for watching the video, and all the best for your upcoming examination, guys. Thank you.